Welcome back to the What's in Your Head podcast, Tools for Pain and Dizziness. I'm Pete Schultz, Doctor of Physical Therapy. Today we're talking about concussion, what's actually happening in the brain, and more importantly, how people fully recover. Concussions are incredibly common, not just in sports, but from car accidents, falls, hitting your head in random ways, even things that don't seem that dramatic at the time could cause a concussion. For a lot of people, these symptoms can feel confusing and unpredictable and honestly pretty scary. Imaging is often normal and you're told to rest and wait it out. There's a ton of misinformation out there. It's hard to know what advice to follow. In this episode, I want to zoom out and explain the big picture. Concussion is not a structural brain injury. It's not a bruise. It's not damage that you can see on an MRI. It's a temporary disruption of how the brain and nervous system are functioning. And the most important thing I want you to hear right away is this: concussions are highly treatable, and when they're managed correctly, recovery is expected. I'll walk you through what's actually going on, why symptoms linger for some people, and how a proper system-based approach leads to a full recovery. Let's get started. Let's start with one of my favorite topics, concussions. I've been working with people who've experienced concussions for the last 20 years. I've seen thousands of people with concussions, and I've seen common trends. But the thing that I notice is that no two concussions are alike. Even though they might have the same mechanism or people might be injured in the same way, the recovery from them are completely different, and everyone's experience is completely different. Concussions are common, not just in sports and not just in football. They're common in life. I have seen my share of people who've had concussions during football games or lacrosse, a lot of youth soccer, but also a lot of car accidents. I have someone that I'm working with now that was attacked by a dog. I have kids that fall off their chairs at school, people that walk into door frames, an endless amount of college students who are always doing silly things to get concussions. Well, concussions could happen for many different reasons. Now, the symptoms you get feel unpredictable and concerning, and there's so much misinformation out there. So how do you know what to follow? It's really hard to know. The best thing you could do is try to find the provider who has seen a lot of concussions. And also, I'm really big on the multidisciplinary approach. I've worked at Hospital for Special Surgery in New York City for about 15 years working in a concussion clinic, and we have a great team. We have a neurologist, we have a nurse practitioner, we have a bunch of physical therapists, an athletic trainer, neuropsychologist, a psychiatrist. So there's a lot of people, a lot of different eyes that are looking at people. The most important thing is managing this correctly. A lot of times you go to your doctor and your doctor just tells you to rest, and that's outdated information. Resting and just locking yourself in a dark room is no longer the way that we approach concussion, and we're going to discuss this a little bit further today. So with a concussion, the imaging is always normal, right? What they're looking for in the imaging is they're looking for a bleed, or they're looking for subdural hematoma. They're looking for something that's out of the ordinary. And then when they don't find anything, then we call that a concussion. Well, concussion findings, we usually don't see anything on the CAT scan, and we don't see anything on the MRI. That's because concussion's not a structural brain injury. Concussion is a functional brain injury. Well, concussion represents an energy crisis, which we're going to get into a little bit deeper in today. The most important thing about concussion, it's treatable and it's recoverable. And if you manage it correctly, everyone gets better. You should get better from a concussion if treated the proper way and you're managing your symptoms correctly. So all concussions resolve when managed correctly, and a multidisciplinary approach is going to work best when working with concussion. What is a concussion? Well, we define concussion as a mild traumatic brain injury caused by biomechanical forces. Basically, any time you hit your head or your body, resulting in some kind of neurologic symptom, we're going to call that a concussion. Well, any hit to the head, any hit to the body, falling on the ground, getting your head jostled, and then having some neurologic dysfunction like dizziness, fogginess, nausea, headache, head pressure, light and sound sensitivity, difficulty reading, difficulty looking at screens, balance issues. These are all neurologic findings that are temporary, and we could see them after an injury. Remember, like I said before, that concussions are a functional injury, not a structural injury. So there's not going to be any damage that is seen on an MRI, and you're not going to see any structural damage associated with a concussion. And it's important to know that there's no definitive test for a concussion. We can't go and you can't take a blood test and say, hey, you have a concussion. Oh, there's no testing. The testing is a clinical exam. Or your neurologist or a sports medicine physician or a physiatrist are going to look at you and they're going to examine you. And then based on your clinical symptoms and the signs and symptoms that you're reporting, we could diagnose a concussion. Don't get scared by the word concussion because when you do have a concussion, know that it is very fixable and concussions do resolve. All right, what's actually happening in the brain with a concussion? Oh, basically, what's happening here is you hit your head. Basically, when you hit your head, your brain does move in your skull, and there is some stretching to the membrane of the brain, which is the lining around the brain. You get an increased calcium influx into the nerve cells, and then you get a calcium-potassium imbalance, which reduces your cerebral blood flow. So you get less blood flow to the brain, and that decreases the amount of glucose that's available or decreases the amount of energy that your brain has to do its regular function. This creates a mismatch between energy supply and demand. What this actually is, it's not a structural injury, it's an energy crisis. We call a concussion an energy crisis because it disrupts the normal mechanics and it disrupts the normal energy flow in the brain. And what this does when the normal energy flow in the brain is disrupted, it causes everything to slow down and you feel a little foggy and you feel a little sluggish and things don't look like they're moving at the same speed and you can't comprehend information as much. It's important to know that this isn't a bruise. It's not inflammation. You didn't break anything. There's nothing torn. This is a functional injury and it causes a slowing down of process. I like to think of it as you have loose wire. So basically, you stretched out some of these areas in the brain, and then now the wires are a little loose, and we have to tighten them up. Until the wires get tightened up, then and everything works well, and all these systems are back to normal. So it's a temporary slowing down of brain function. Again, there's no bleeding, no inflammation, no damage, and these symptoms will resolve. When managed correctly, normal recovery from a concussion is about 1 month. And this is interesting because concussion is actually an injury where the younger you are, it actually takes a little longer to recover. We're finding that our teenage athletes take a little bit longer to recover than our college athletes. And then our college athletes take a little bit longer to recover than the professional athletes. Basically, adults actually recover a little quicker from concussion than children do or younger adults do. And this might be because as the brain's developing, it could be because hormones, it could be because as the brain's developing, there's so much going on and so much growing, and a mature brain just recovers a little bit quicker. We're also finding differences that sometimes women take a little bit longer to recover than men, and concussions are actually a little more common, or persistent symptoms after concussion are a little more common, we're finding, in women than in men. And that could be for a couple of different things. Sometimes there is a higher prevalence of post-concussive or post-traumatic migraine, or there's just a higher incidence of migraine in women in general. Well, people who have migraine are more susceptible to a prolonged recovery from concussion. And also women tend to have weaker neck strength. The neck musculature in females are a little weaker than neck musculature in males, which makes them a little more vulnerable to concussion and maybe a little more vulnerable to persistent symptoms or a longer recovery. That's kind of what you could expect. But all in all, I would say that it takes about a month to fully recover from concussion. Now, people who have delayed recovery, that could be for many different reasons, but we're finding that delayed recovery is usually due to mismanagement, not mechanism of injury. For example, we've had a person that was on a business trip to Las Vegas, and then he had a concussion. He fell, banged his head, reported some neurologic signs, and he had a concussion. He spent the next 2 days staying out all night, gambling, looking at all the lights, the bright lights, going to concerts. And obviously that's probably not ideal after you have a concussion. And he was set up for a longer than normal recovery. And it took him, he still got better. It took him about 2 months to get better from a concussion, but he significantly lengthened his recovery because in the initial stages, he was just doing a little too much and overloading his system a little bit. And opposed to that, on the other side, we have people that got a concussion, got really scared, and then locked themselves in a dark room for a week and didn't move out of the dark room. And that person took longer because once you get out of that dark room, it's really hard to get back to normal life. That person still got better, but that person maybe took 2 months or 3 months to recover, not necessarily because their symptoms or their concussion was worse. It was because they just mismanaged their recovery. Remember, this concussion, it's not a structural injury, it's a functional injury, and it's really due to different chemical processes or wiring problems in the brain. And I like to think of it as the difficulty with a concussion is really the wiring between the brain and the systems. And the systems that are involved are your vestibular system and your visual system and your musculoskeletal system, all these systems, and your visual and vestibular for the most. When you see a doctor, proper assessment matters the most. You want to get a good, thorough assessment because each concussion presents differently. And once you've seen one concussion, basically in the concussion world, for people who treat concussions regularly, we always say once you've seen one concussion, you've seen one concussion because they all present differently and recoveries are all different. And that's why the one size fits all approach or something that you might see online isn't going to work for everyone. And people just, you have to manage it based on the symptoms you're having and what you see in front of you. Oh, the other day I had someone call me up. They're like, "Hey, Pete, you work with concussions. Oh, I think my son had a concussion. What do we do?" And I feel like that's a question that I get often. What you should do is you should see a doctor who works with concussions regularly, is usually what I'll say. Because I get the same thing with knees. Like I have a guy that comes up to me all the time and he knows I'm a physical therapist and he's like, "Give me something to do for knees," right? And obviously it's a knee problem. Do I know how you injured it? Do you have arthritis? Is it a meniscal tear? Did you injure it playing sports? There's a lot of different things that could be wrong with your knee. I can't just give you one or two exercises that generally fix all knees. And the same thing, there's not one or two things that you could do for concussion. What I would recommend first is that if you sustain a concussion or you suspect that you have a concussion, go to your doctor. Kids, go to your pediatrician. They're a really good resource for this. If there's a concussion clinic in your town or in your city, you want to definitely go to someone who sees concussion regularly because you want to have this concussion properly managed and you need a proper assessment. Because we know now a lot of times I see so many people that their doctors just told them to rest for 2 weeks and didn't really give them specific instructions because we know that resting for a prolonged period of time could actually delay recovery. Some people are told to rest and some people are told not to rest, and it's really based on your assessment. Someone who doesn't have a proper assessment can lead to lingering symptoms and longer than normal recovery. Now, this is another important topic that I want to talk about is that I truly believe, and the professionals that I work with feel the same way, that once you fully recover from a concussion and all your symptoms, all your systems have fully recovered, you're no more likely to get another concussion. So a lot of times people who feel like they're more susceptible to concussions is because they haven't fully recovered. They didn't get a proper assessment. Maybe they missed something in their visual system, or maybe they didn't fully recover their vestibular system. Really having a full proper assessment and having a full recovery will ensure that you are no longer susceptible to concussions than you were before. And I feel like it's really important for kids and adults to exercise and participate in sports. And I never told anyone that they shouldn't exercise. And I rarely told someone that they could no longer participate in sports, right? Sometimes we have a couple of people that after concussion, we found some stuff in their neck or some instabilities in their neck that it would probably be better if they didn't play contact sport. We've recommended those people to stay out of contact sports. But for concussion, once you're fully recovered, go back and play your sports. Go back to contact sport. Contact sports are important. They're an important part of growing up. If you enjoy playing them, go play them. Go skiing. Do everything that you want to do. So it's important to get back to the activities that you enjoy doing. So, like I said before, concussions affect multiple systems. And the systems that we're looking at are your visual system, which is your eyes, your vestibular system, which is your inner ear, and your brain, which controls your balance and equilibrium, your neck, and your autonomic nervous system. So these are the main systems involved. And when you have a concussion, your symptoms are going to show a bias towards one or a few of these systems, and that's how your treatment is going to be derived. Basically, we're going to develop your treatment based on the bias of which symptom is more involved based on your assessment. So a proper, thorough assessment will identify which systems are impaired and what your treatment should address. So now we're going to get into basically, there's 5 sub-classifications of concussion and what to look for and if you have symptoms in each one of these. The first thing that you're going to look at is the neck, right? Is this concussion more of a whiplash type injury, or are there symptoms mostly coming from the neck? Are the persistent symptoms mostly coming from the neck? And basically, because neck symptoms from a whiplash type injury could mimic concussion symptoms, and they're often very similar. People with whiplash have headaches, they get lightheaded, they get dizzy, they probably don't have the visual issues or like light sensitivity, but they experience a lot of the symptoms that people with concussions have. The interesting thing about concussion and whiplash that I find really interesting, it takes about 40 to 100 Gs of force to get a concussion. So it takes a lot of force to concuss the brain. And it only takes 4 to 10 Gs of force to get a whiplash or strain a neck muscle. So you have to hit your head 10 times harder to get a concussion than you do to get whiplash. We could postulate that if you hit your head hard enough to get a concussion, you likely have at least strained the muscle or a ligament in the neck, and there's probably some neck involvement. But we always look at the neck when someone has a concussion. Someone should always look at your neck. And what we're looking for in the neck is we're looking at how the neck moves. Do you have any restriction in range of motion compared to what you had before your injury? Do you have any instability there? Are the muscles really tender or the muscles weak around the neck? And then there are certain neck exercises or neck strength tests that we make you perform to make sure your neck strength is adequate to help you recover from the concussion, but also to help prevent further concussions. So some of the symptoms that people will have when they have a cervical bias or a neck-related bias to their concussion symptoms would be one-sided headache, one-sided or back of the skull headache, which is a unilateral temporal or occipital headache. And this is basically a cervicogenic headache. Also, they're going to have neck pain. They're going to have limited cervical range of motion, and the symptoms are going to be worse with movement. When you move your neck, that might increase your headache or that might increase your dizziness. Some treatments that you could that you could look for or that could be treated for a neck bias with concussion symptoms would be some manual therapy to improve your neck range of motion, neck strengthening exercises, and posture exercises that will help prevent future recurrences of concussion. The second system that we're going to look at is the visual system. The visual system is your eyes. So now there are tons of neural connections between your brain and your eyes, and there's a lot of wiring in there between the connections between your brain centers and the visual system. And these often get slowed down after concussion. There are many visual pathways in the nervous system. And what we usually see with someone who has a vision bias is their eye strain. Or they have a really hard time moving their eyes from side to side, or they have a really hard time tracking an object or following the doctor's finger. We see someone really straining. They also have light sensitivity and complain of difficulty with screens, and headaches while reading and headaches while looking at screens. The assessment, we're going to have them do some eye tracking. We're going to have them see if they could jump from target to target with their eyes. We're going to see if they could look at an object that's close to their nose and far away. And we're also going to look at skew deviation. So we're going to look at, do they have or have they ever had strabismus or a lazy eye, because that might set them up for a prolonged recovery due to visual bias. So some of the symptoms we're going to see are eye strain, blurry vision, headaches, difficulty reading, and visual fatigue. Some of the treatments that we could do for a visually biased concussion would be eye exercises to improve eye tracking, saccades, convergence, strengthening those muscles around the eye. So we're going to strengthen these muscles, and we're going to strengthen the neural pathways that go between the brain centers and the eye and the visual system. And these get strengthened through neuroplasticity. The more you do these exercises, the quicker those connections are going to run. The next system is the vestibular system. So the vestibular system function is balance and equilibrium. Well, the vestibular system is the inner ear. Inner ear consists of semicircular canals and utricle and saccule. You have all these structures in your inner ear that are like a level. You know, when you're hanging a picture, you have to make sure the picture's straight. So you have one of these bubble levels. So consider something like that in your inner ear that basically tells your brain where you are in space. Also in the inner ear, you have gravity detectors that are going to tell where your body is in space. And you have the semicircular canals, which are like accelerometers. They test angular acceleration. They know how fast and what direction your head is moving. Some of the things that we could assess for a vestibular bias concussion would be the ability to stabilize your gaze on an object, the ability to look at an object and turn your head really fast and make sure that object doesn't move. We're going to also look at balance. You're going to look at your balance with your eyes open and with your eyes closed, and your ability to tolerate motion. Are you getting more car sickness? Do you feel like you're on a boat? Are you unable to go on a merry-go-round with your kids? And some of these symptoms that you're going to be describing if you have a vestibular bias concussion would be dizziness, nausea, motion sensitivity, feeling off balance or feeling unsteady. Another thing that they've found that the most important symptom in sports-related concussions, the most important on-field symptom to see if the person is set up for a longer than normal recovery is dizziness. So oftentimes, if we suspect a concussion in a football game and someone gets up off the ground and they're complaining of feeling dizzy, we're going to keep an eye on that athlete. And because having dizziness on the field or having dizziness right after your concussion sets you up for a longer than normal recovery. Now, when I say longer than normal recovery, I don't mean 2 years. I mean a longer than normal recovery. If normal recovery is 4 weeks and this is managed correctly, this might take 6 weeks or this might take 8 weeks, but this person is still going to get better and going to improve. But we're just going to watch them a little closer if they're complaining of dizziness at the time of their concussion. So the treatment for vestibular bias concussions are focused on restoring balance and being able to tolerate motion through vestibular rehabilitation principles. The next thing we're going to look at is the autonomic nervous system. One of my favorite topics is the autonomic nervous system. When someone has dysfunction or autonomic dysregulation, there's going to be some impaired regulation of heart rate, blood pressure, and temperature regulation. So they're not going to be able to adjust their heart rate properly during exercise or during movement. And their blood pressure is going to fluctuate not the normal way. Well, these people often feel lightheaded. They feel like they're going to pass out. They don't feel right. They feel fatigued. They're not sleeping well. And they have a reduced tolerance to physical stress. What we do, the way we find out if someone does have an autonomic nervous system bias or an exertional bias to their concussion, we do exercise tolerance testing. We get them on a bike. We have them walk on a treadmill. We monitor their heart rate. We see at what heart rate are your symptoms, at what heart rate do your symptoms get worse? At what heart rate do you start to get a headache? Do you start to get lightheaded and dizzy? And then we could adjust their exercise program according to that heart rate response. So we want to make sure that as you're recovering from concussion, we could see when your autonomic nervous system is regulating the way that it should be regulating by being able to monitor your heart rate and being able to monitor you during symptoms. And at the Hospital for Special Surgery clinic, we have a great athletic trainer, and he monitors everyone's symptoms while they're exercising. And before he could clear the autonomic nervous system, he makes sure that you could exercise with your heart rate at 160 or 180 beats per minute for a prolonged period of time, and your blood pressure and heart rate and everything is responding the normal way without symptoms. So if someone does have autonomic dysregulation, you might see fatigue, lightheadedness, inability to exercise, and their symptoms usually flare up with activity. The next category is we often call mood, anxiety, emotional regulation, and cognitive fatigue. It's all kind of batched into this category. And it is by far the most common of all the concussion symptoms. And no matter what your symptom bias is, people typically will have some anxiety or emotional overlay in their symptoms. Because the emotional centers of the brain are affected with concussion. And it's interesting with concussion, because in concussion, whatever you have before, after concussion, it gets a little worse temporarily for a short period of time after. So if you had a little bit of anxiety, maybe that anxiety is heightened after a concussion. And if you have a little bit of inability to handle stress, maybe that gets a little bit worse. And everyone has a little bit of anxiety. Surprise, everyone has a little bit of anxiety. Everyone has a little bit of inability to handle stress. Oh, your stress response gets a little bit altered after concussion. And these symptoms, it's really important to know, it's not, you don't have anything wrong. And it's not a psychological problem, or it's not psychosomatic. I don't like using that word at all. But what happens after a concussion, you just have a little heightened anxiety. It's scary. There's a lot of information out there about concussions, a lot of information, a lot of lawsuits, football players, and all these things. They sound really scary. It's normal that if you have been diagnosed with this concussion, it sounds really scary. But in reality, it's not. It's an injury, and it heals, and they get better. Oh, there are things to do for your anxiety if you are having heightened anxiety after concussion. And what we do is we start with breathing exercises for emotional regulation. In our clinic, I do a lot of biofeedback with people, and I teach them how to regulate their autonomic nervous system using biofeedback or neurofeedback, or even some light meditations and body scans. And there's other ways to regulate your nervous system. And this is all going to help you recover within the normal time frame. People in the mood anxiety category will often report mood changes, anxiety, irritability. A lot of times I always ask them, do you notice you're yelling at your parents a little bit more, getting more emotional? I remember specifically I had this NFL player who came in and he's like, I don't know what's wrong with me. I was watching TV with my wife and I started hysterically crying during commercials because he got emotional. I told him, hey, that's pretty normal. And I'm actually going to, if you don't mind, I'm not going to use your name, but I'm going to tell this story because I see this all the time. And no matter how big or strong you are, it affects your emotional centers. I assure you, this is temporary and it gets better. And there are things to do to speed it up. And those things are working on your self-regulation and working on and doing your breathing exercise and trying to improve your heart rate variability and trying to get better sleep and take care of yourself during this time. These symptoms will resolve quicker. So before we return to play, or in order to check off this box, we want to make sure that you're back to your pre-injury emotional baseline and have at least the similar anxiety as you had before your injury. The next category, it's not really a category, it's just very common to have post-traumatic headache or post-traumatic migraine following a concussion. So migraine or post-traumatic migraine are very common after concussion, and they often are the main reason that people do have prolonged recovery. It's the similar patterns to a regular migraine where someone has intense headache behind the eye or on one side of the face. They have some visual disturbance, some floaters or spots they see on the wall or wavy lines. Usually comes with an intense headache, and obviously it comes with dizziness and nausea and light sensitivity. So it's important to know that these, sometimes if they persist longer than the month or longer than normal recovery from a concussion, they're often managed with certain medications. And these aren't medications that you're going to have to take for the rest of your life, but you want to make sure you could manage this headache. You want to make sure you go to the appropriate doctor, because one important thing is taking over-the-counter headache medication often will make these headaches worse, because there's something called medication overuse headache. What happens is, as if you take ibuprofen or acetaminophen, something over the counter, if you take them too many days in a row, say you have a headache for 2 weeks and you're taking an over-the-counter NSAID every day, when those wear off, your headache gets worse and it comes back. The withdrawal from the headache medication is actually causing the headache. So you get these medication overuse headaches, or rebound headaches, we call them. And that could be prolonging your recovery. So this often happens with people who have a history of migraine or a history of motion sickness. And we notice that if you have a history of lazy eye or strabismus or something going on with your vision and a history of anxiety, you might be more prone to these post-concussive migraines or these post-traumatic headaches. Putting it all together, it's important to get a proper assessment after you have a concussion, identify which systems are involved, and you should be able to see which system's involved by getting a good assessment and having objective findings from a physician or a physical therapist or trainer, someone who is used to seeing people with concussion. They want to determine the bias of the symptoms and which system is involved. Then you're going to treat the impaired systems, whatever's delayed, and you should have a full recovery. I often think of it as a checklist. You have a checklist for your neck, your visual system, your vestibular system, your autonomic nervous system, and your mood anxiety. And if we could check all those boxes off, you have a full recovery. And that's your full recovery. And that's how you treat a concussion and make sure that you have a full, normal, quick recovery. Oh, treating a concussion is, I feel like it's an art. You definitely want to go to a physician that works with concussions regularly. So now, rest versus active recovery. We touched on this a little bit. It's really hard to say who should be doing what without seeing what the bias of your symptoms are. But the one thing I know for sure is that we no longer put people in a dark room for a week, right? That's an old, antiquated system. And if you do have a concussion, The recommendation now is to rest for about 24 to 72 hours. But after that 24 to 72 hours, you need to be active. You need to go out. You need to move yourself. You need to exercise. You need to try to get back to normal life. You definitely can't stay in that dark room anymore. And then after that initial phase of the 24 to 72 hours, we are going to gradually reintroduce activity. And we're going to gradually reintroduce activity at a normal rate depending on your symptoms. So when you see people in the NFL or people who play professional football, they go into a protocol, and those protocols are based how they tolerate. The first day, they might ride a bicycle, and if they get a headache from riding a bicycle, then they have to go back to that first day again, and they don't progress to the next level until they're symptom-free from riding the bicycle. Oh, and then once they could do that, then they could do some light jogging. And then if they could do light jogging, then you go to light practice. And then if they could do light practice, and each thing we're going to monitor for 24 hours to get those people back to their job, which is, in that case, playing football. The early phase is this initial 24 to 72 hours where you're going to see a lot of people are recommending that you rest. And after that stage, we start an active recovery, and that's based on what your symptoms are. So at this point, after the 72 hours, your symptoms starting to resolve a little bit. And if you're feeling dizzy and you're having vestibular symptoms, you're going to want to do things that tax your vestibular system, work on your balance, work on moving your head, work on some motion. If there's neck symptoms, you want to go to some physical therapy for your neck. Get your neck work done, get some light massage, get some range of motion back, do some posture exercise, do some strengthening. If it's an autonomic nervous system problem, you want to start doing your breathing exercises, do some biofeedback, get your nervous system regulated, walk on a treadmill, ride a bike, do something to get your sympathetic nervous system going, and then work on some self-regulation, relaxation exercises. So active recovery is really important, and you need to try to encourage people to get back to what they're doing. And again, the most important thing is to have a very good assessment from a team, which in this case, it could be a neurologist, it could be a pediatrician, physical therapist, athletic trainer, psychologist, nurse practitioner, a team of people who work with concussions regularly, and you want to figure out what your symptom bias is, and you want to try to target those systems and try to get yourself back to a normal recovery. So in closing, concussions are very treatable, and a multidisciplinary approach works best with this population. Recovery is expected, and 80 to 90% of people with concussion will recover in 1 month. So it's normal recovery from a concussion is 1 month. And there are 10 to 20% of people that for some reason don't recover within a month, but they still recover. And recovery is still possible and is still normal in everyone. Oh, if you have a concussion, it's just like any other injury, and you will get better and you'll recover. Make sure you see a good team, right? Go to a physician or go to someone who's used to working with concussion and get it managed correctly, and you will get better. The persistent symptoms, or the group of people who do have prolonged recovery, it's often because you might have missed something in the evaluation, or maybe one of the systems wasn't addressed. Sometimes you might need a little more vision therapy, or maybe the neck wasn't fully addressed, or maybe you're still having some vestibular symptom. Oh, it's never too late to get yourself a full recovery and get a proper assessment by a good team that works with concussion. Before we wrap up, I want to leave you with this. Concussion symptoms can feel overwhelming, but they are not a sign of permanent damage. A concussion is temporary disruption of how the nervous system is functioning, and when all the involved systems are properly assessed and treated, recovery is expected. If symptoms are lingering, it usually doesn't mean something is wrong with your brain. It means something was missed. This episode is meant for education only and is not medical advice. Every concussion is different, and treatment should always be individualized by a qualified healthcare professional. If you or someone you know is dealing with a concussion and symptoms of a concussion and wants a thorough system-based evaluation, You could schedule a physical therapy appointment at dynamicsportspt.com. Thanks for listening to the What's in Your Head podcast, Tools for Pain and Dizziness. And remember, recovery is not only possible, it's expected.